Good evening and welcome to ATV. I'm Suad Asfour, your host. Chiropractors are often the first stop for people seeking preventive care or treatment without using medication or surgeries. My guest today is Dr.Rick Mansour. He is here today to tell us a little bit about chiropractor care and treatment. Welcome to the show, Dr. Rick.
Thank you.
Thank you for coming.
Thank you for having me.
Dr. Rick, can you tell us a little bit more about yourself, first of all?
Sure. I'm married. I have 4 children, and I have 6 grandsons.
Wow.
And so I've been very blessed. I've been working as a chiropractic doctor for 30 years.
Wow.
So
in Gilroy, in the city of Gilroy? Same
yes.
location?
Yes, in the same location
Great.
in Gilroy, California.
Uh-huh.
And that's...
So what made you interested to become a chiropractor?
Well, that goes way back. Actually, it started in 1979 when I graduated from the university. I had a friend whose father was a chiropractor. And at that particular time in my life, I was searching, and I was looking for a field that would offer a wellness approach to healthcare that didn't involve drugs. And the reason is because I saw a lot of damage to what illegal drugs and legal drugs did to people. And so I was wanted to find a profession that embraced that philosophy of wellness, and that's what got me interested in it.
Mm-hmm. Okay, so let's start from the very beginning. What are the requirements that you need to become a doctor as a chiropractor?
Well, the requirements are similar to getting into medical school. You have to have at least you have to have a bachelor's degree to begin with.
You have to finish high school?
Finish high school.
Finish high school.
Right, and then 4 years of college, which include the sciences, chemistry and biochemistry and anatomy and physiology. And then it's 3.5 years more of schooling outside of the university. So it's 3.5 more years. So then you're taking the same kind of classes that you would if you went to medical school. The only difference is that the focus is mainly on the neuromusculoskeletal, the bones, the muscles, and the nerves.
Oh, you have to study all that.
But you have to study all that, exactly, right.
Okay, so what does chiropractor treat or diagnose?
Well, I mean, as far as diagnosis is concerned, we have to diagnose disease. So whether you have a back problem, if you came in with a back problem and actually it was let's say something that was like an arterial problem or a tumor or an infection, I would have to be able to differentially diagnose that because, of course, we're legally allowed to diagnose disease. In fact, we have to diagnose disease because I could hurt you if I didn't know what your problem was. So we can do the same types of tests, blood tests, we can do MRIs, we can do x-rays, take histories of our patients. But primarily what we treat is back pain and neuromusculoskeletal problems.
So what are the basic principles of the chiropractor care?
Well, that's a good question. The principle is based on the fact that the body can heal itself. And a good example of that is probably when you were a child, if you ever got a cut. I remember as a young child, there was a topical that you'd put on the cut called mercurochrome. And I remember it burned really badly.
Right.
And they'd put that on you, and then you'd put a Band-Aid on it, and then miraculously I thought, well, the mercurochrome really worked because it healed it. And then maybe, 5 years later, it was bacitracin, which was another antibiotic or cream that you put on a cut, right?
Uh-huh.
And it healed. And then I realized that really it wasn't the mercurochrome or the bacitracin, it was really my body that was healing itself. So, the principles of chiropractic is that the power that made the body is the power that can heal the body as long as there's no interference to the nervous system. And of course, we expand upon that as well. So,
so we do have a pharmacy basically inside our body that help us to heal.
Exactly.
right?
We do. We have a pharmacy inside our body that helps us to heal. We have an immune system, and everything is controlled by the nervous system, right? So everything your body does, from the heartbeat to so your stomach digesting its food to everything, is all based on the nervous system. And you know that because if you ever cut a nerve to a particular organ, that organ would stop functioning. Okay? So our philosophy is that if you have pressure on the nerve, it's going to can eventually affect whatever's at the end of that nerve, whether it be your heart, your stomach, whatever.
Yeah, but people have this idea like they don't believe of going to a chiropractor unless they have an alignment problem, or like they feel like they're not walking straight, or they have seriousness with their back and they don't want to go to the doctor. But they don't consider the chiropractor as somebody they can go to anytime. What is that philosophy all about?
Well, I kind of blame chiropractic on that, the reason is because people aren't educated on the fact that chiropractors are, doctors that can diagnose disease. Can they treat everything? Absolutely not. If you had something I need to refer you to a medical specialist for, of course I would do that. I've had patients who, I'll give you an example, came in with a headache. And I evaluated her. She was an older woman. She's had these headaches. So during my evaluation, I found out that she had what they call stenosis of the carotid arteries, which means that she had clogging of the arteries. And I picked that up on with a stethoscope. And I immediately sent her out to a surgeon to have that taken care of. A specialist, right. You're right. So, no, I wasn't going to treat that aspect of her problem, and I got her out of there as quickly as I possibly could. So, again, we need to diagnose, but as far as some of the more unknown things that we treat, again, those are the things that some people don't understand, that, oh, well, maybe my stomach hurts because I have a subluxation or a bone out of place in my mid-back, which is affecting the nerves that go to the stomach. And that's why I'm feeling this agitation to my stomach. Or sometimes a rapid heartbeat, or, those types of things. So.
Well, I'm thinking people don't have that much trust in chiropractor because they don't know how to pick one. So what's your suggestion how to find the good chiropractor? Now, we know the insurance company doesn't cover that, and most of them are on their own, to pick their own chiropractor, right?
Well,
so
no, not
how
necessarily.
Do we find a good one?
Yeah. Insurance companies do cover chiropractic. Okay, so you do have Blue Cross, Blue Shield, Medicare. The big ones, Aetna. A lot of them now are HMOs and PPOs and things like that, and they do have chiropractic coverage. But that's dwindling for not just chiropractors; it's dwindling for all the healthcare professionals,
right,
just because of what's going on. But how to pick a good chiropractor? I think you can go to the California Chiropractic Association. We have a large association, and you can ask them, what are some of the how to pick a chiropractor. Primarily, it's just like how you pick your medical doctor, or you pick your dentist, or you pick your, whoever. You have to go by referrals. People tell you, oh, he's great, he's did a good job. And a lot of it's referrals, and then maybe asking them where they went to school, and, that kind of stuff.
Yeah, so what do you say to people who are skeptical about chiropractors?
I tell them that's fine to be a skeptic. I don't blame you being skeptical. Just don't be closed-minded, because a lot of people base their opinions on chiropractic not on experience, but on hearsay. And usually that hearsay is from somebody who's never been to a chiropractor, never experienced chiropractic, and has no knowledge about it. But they just kind of throw the baby out with the bathwater because, they might have heard from somebody that, oh, this, person got hurt. Well, if you went to your medical doctor and you had a bad experience, you wouldn't throw out all medical doctors. You'd go find somebody else. And it's the same thing with chiropractic. You would just, you got to find somebody that works.
Oh, great. So if you were not a chiropractor, what would you do?
Ooh, that's a good question. If I wasn't a chiropractor, what would
you do with your life?
Probably teach yoga.
Oh, yeah.
No, I'm just teasing. I don't know. I love chiropractic. I always wanted to be in the healing arts, but when I was in college, actually, my undergraduate major was philosophy, and I wanted to teach. So probably be some kind of a teacher.
Well, I never been to a chiropractor, even though I know you for a long time and you're always there, but I never had the need for it. So what are people like first visit? Patient come to your office for the first visit. What are they like? Are they nervous? How do they behave? How do you build rapport with them and get them comfortable? How do they act?
They act all differently. I mean, some of people who've never been to a chiropractor have lots of questions, and they ask me a lot of questions. Mm-hmm. So I try to keep them calm in that regards. I mean, essentially, it's like, you know, I mean, we take a history, and I learn more about my patients before I touch them or examine them or anything like that. So a lot of it is talking. So the first maybe 15, 30 minutes I talk, and I let them ask me questions. And hopefully I answer them to the best of my ability. And, you know, and of course the biggest question is, does it hurt? You know, is this going to hurt, you know? And to answer that question, it's hard because some people I've had come into my office, they can't even walk. I mean, people have actually literally had to carry them in because they hurt so bad. And so, you know, we have to deal with that. And again, since we're a drugless profession, that's a tough one because if you're in a lot of pain, I'm not going to be giving you medications. And it's, you know, it's just not our philosophy, but we can do things to help with pain. So we do a lot of, you know, ice, or we do physical therapy like ultrasound, or I have a laser in my office that helps with pain. So we can do other things.
What's the weirdest thing that any of your clients did from first visit?
The weirdest thing that they did, or the weirdest thing that they came in with? Oh, the weirdest thing that they did?
Yeah, either way.
That's a good question. I had a, well, there's certain stories I can't tell you, but there, you know, I had a patient that screamed really loud when she got adjusted, and I guess the door was closed and there was somebody waiting outside. So when I opened the door, I remember him saying, "I'm not going in there. I heard her scream." But she, you know, I said, but she couldn't walk when she came in, and now she's walking. So he came in.
Oh, good. So that was a good example for your work.
Right, right.
Wow, that's good. So what is the most rewarding gift that people receive from the chiropractor?
Well, the most rewarding is really helping people get well and then helping people stay well. And that's really rewarding. And we see all age groups too. I mean, we see people, I've treated as young as a 1-year-old all the way up into a 95-year-old man. So, I mean, it just depends. And I know a lot